Hey guys, Dr. Nizam, Alabama Surgical Arts. This is my lovely 68-year-old patient. I'm going to tell you how we went to this, and these photos were taken 13 months apart. Basically, we started with a deep plane lower face and neck lift using preservation techniques, a submandibular gland shave, and a chin implant. That gave back this beautiful jawline, got rid of all the deep contents of the neck, all that heavy stuff that we all hate we get in the neck as we age. And then one of the real big hallmarks I always encourage you guys to look at this cheek. When you see that cheek raised up, that's a really good hallmark of a well executed deep plane lift. We also added some fat transfer for volume into the cheek. You look at the neck, you can see, yes, that is indeed a great looking neck, and all that deep volume has been taken out. And then if you look here, you can really appreciate how much we did, and all that's been kind of lifted away to reveal those contours when we took out all the contents. You can look at the incision, you can see it is very hard to see. Now, one of the things I always say is this: deep plane lifts, they don't result in stretching the scar, so you get very thin, scar lines. The only negative I will say sometimes is people with really dark skin, you can see the white if it's a very hypopigmented line. Now, we tattooed back in the pigment, so it's very hard to make out our incision. That's the one thing I always tell you guys: don't get tied up on incisions. If you look at any of my before and afters, it's really hard to see them. This is her front view, and you can see we did a total facial rejuvenation, as I always stress. Upper eyelids were done at a second stage with just some filler to add volume back and a chemical peel to address the hyperpigmentation. Altogether, she gets a beautiful result.